TB or not TB? That is the question. Good day and welcome to Kiddies Corner. Today we are going to talk about a serious subject. That is the TB medicine that we give our children when they are newborn in hospital. The reason why I call it medicine is obviously because I do not want to get my video removed. Now with that said, I'm not an anti-vax mom. I'm a be informed mom. And what I want to do today is only share with you the facts that you can go and read up for yourselves. When you hear these facts, decide whether it is in your baby's best interest to receive the TB medicine. If you Google the TB vaccination in South Africa, you will see that all children receive the BCG vaccine at birth in South Africa. But this is not true for Europe and American babies. It is a live vaccine given to stimulate the baby's immune system to build antibodies to protect against TB. The BCG vaccine is given by an injection just under the skin, usually on the upper left arm. It's important to know that a newborn hasn't developed their immune system yet. It is only between 2 and 3 months that the immune system starts to develop. You might ask, but why wouldn't you want my baby to get the medicine if that will mean that it will boost the immune system? Well, here are the reasons why. Number 1. This medicine is not given to all newborns across the world. Now we have to ask ourselves, why? The best place to find our answer is in the medicine's package insert. The insert is the paper in the package that tells us all about the medicine. It tells us how it's administered, it tells us what it contains, it tells us the side effects, and also when and when not to use the medicine. When you open up the package insert, you will see that it says, BCG vaccines should not be used in infants, children or adults with severe immune deficiency syndromes. Children with a family history of immune deficiency diseases should not be vaccinated. If the insert says that we shouldn't give it to children who has immune deficiency syndrome, then I want to ask, why would you give it to a baby that doesn't have an immune system at all? The second thing that I want to highlight in the insert is the following sentence. Before administration of BCG vaccine, healthcare personnel should inform patients or guardians of the benefits and the risks of immunization and inquire about the health status of the patient. Do the medical personnel do this before they give the TB medicine? The third sentence I want to highlight in the package insert is the following. Under pregnancy, animal reproduction studies have not been conducted with BCG vaccine. It is also not known whether BCG vaccine can cause fetal harm when administered to a pregnant woman and can affect the reproductive capacity. Although no harmful effects of the fetus have been associated with BCG vaccine, its use is not recommended during pregnancy. It's important to note that the TB medicine in South Africa is even given to preemie babies. Let's look at the fourth topic. The package insert says, under nursing mothers, it is not known whether BCG is excreted in human milk because many drugs are excreted in human milk and because of the potential of serious adverse reactions from BCG in nursing infants. A decision should be made whether to discontinue nursing or not to vaccinate, taking into account the importance of tuberculosis vaccination to the mother. They state that there can be a severe adverse reaction in infants. Yet, this medicine is given to newborns moments after they are born. And here is the kicker. In the vaccination insert, it says, when is the BCG vaccine given? The vaccine is given to a baby if they are likely to come in contact with someone who has TB. This includes babies who live in the area with high rates of TB, have parents or grandparents that are from a country with a high rate of TB. The vaccine is offered if your baby is newborn or when you bring your baby home. Let's see what the CDC website has to say about the TB medicine. BCG recommendations. In the United States, BCG is only considered for people who meet specific criteria and in consultation with a TB expert. BCG vaccinations should only be considered for children who have a negative TB test and who are continually exposed and cannot be separated from adults who are untreated or ineffectively treated for TB disease, and the children cannot be given long-term primary preventative treatment for TB infections, or if a child has a certain strain of TB. If you are a pregnant mommy, then this is very important information, and you need to ask yourself, are your children in that situation? Do you think it's viable to give your child this medicine? Do you think they need this medicine? Is it ever a good idea to give your child medicine that they do not need? The last thing I want to mention in this video is the side effects. I actually tried to make a list with all the side effects, but they are so difficult to pronounce. I think it would be better if I just put them up on the screen. These are the risks that you are taking when you give your child this medicine. In the end, you have to decide, do the risks outweigh the benefits? Again, I'm not saying that you shouldn't vaccinate your child. I'm saying make an informed decision. If after this video you still feel the need to give your baby the TB medicine, because maybe you feel like you're a bad parent if you don't, then at least wait a few weeks for your baby's immune system to get stronger. And that also counts for all the other medicines that they want to pump into your baby, that maybe their little bodies are just not ready to receive. Remember that you are responsible for your baby, so you must make the decisions that are best for their health. There's one more point I would like to make, and I want you to challenge your healthcare professionals on this. In the insert, under pediatric dose, it says, in infants less than 1 month old, the dosage of BCG vaccine should be reduced by 1/2 and using 2 ml of sterile water for injection. If you decide that your child still needs to receive the TB medication, make sure that your healthcare provider is following these instructions. One last thing I want you to think about is when they talk about a live culture or live bacteria, they use MRC5 cells. Not just MRC5, there are different variations of the cells. What are these MRC cells? Perhaps you should Google and find out for yourself. Nobody wants to harm their babies intentionally. It is my prayer that this video will reach the right people. If you are unsure and you are weighing up the options, rather go do the research. It's a quick Google search. May Abba bless you and your family. If you are pregnant, may Abba Father help you decide what is best for your baby, regardless of what I said or what I didn't say. And mommy, whatever you are doing a good job.